So I think it is important that we consider men's health and give equal importance and the areas that we need to look into. It is kind of difficult, especially somebody who is in the younger age group, like 20, 25, 27-year-old, to impress upon him to come and see a doctor once a year. And the usual response is, "Doctor, I feel fine. I play tennis, I play football, there's nothing wrong with me." So you'll have to explain to him what are you looking for, and you could be completely asymptomatic, running around with a high blood pressure of 140 by 100. A lot of these abnormalities we sometimes pick up on the sports physicals, but there is some elements of drastic diseases which can be identified and prevented if somebody looked into it. If you are looking at adolescents and college-age students, and especially if they are sportsmen, you want to look at cardiac issues first. The first one is hypertrophic cardiomyopathy, where there's enlargement of the cardiac muscle from a genetic reason, not from because of heart attacks or something. And these are the people who have sudden death playing basketball. So these can be identified easily with simple tests like an EKG or an echocardiogram, or even examining the patient, you get some clues. Hypertension is another disease that is totally asymptomatic, and as you get the blood pressure done, you will not know. Sometimes you have respiratory illnesses, like restrictive lung disease, or people even who have a mild asthma, but with exertion gets very intensely increased symptoms they have. Erectile dysfunction is basically a vascular problem, but in the only genital area you're looking at it. But once you have one area of vascular problems, you will have to look at the other vascular beds, which will be the carotids going to the brain, which will be the coronaries going to the heart, which is going to the peripheral vascular disease, which is going to the legs. Those are all, some of them are very asymptomatic and may not be noticed unless you put them through some kind of a vigorous testing, like exercise testing or something like that. I would definitely probably keep age as one of them. A family history is another thing that I would certainly, and risk factors that the patient has, if he is a smoker, if he is obese, if he is non-compliant with doctor's recommendation, and these are the things certainly.